Good evening, Mutsa. Thank you for taking time to visit with me, David Rupert, on behalf of the BYU Management Society Young Professional Career Engagement Program. And we'd like to start off by having you just give a little introduction of who you are, where you live, and what you do for a living.
Thank you so much for this opportunity, Rupa. Um, my name is Mutsa, Samantha Sithole. I am 27. I am a wife. I am a mother of two, and I'm also a medical doctor. I am currently employed as a junior resident medical officer at one of Zimbabwe's central hospitals. So I'm from Zimbabwe, Southern Africa.
That's beautiful. That's beautiful. And how long have you been married?
We've been married for 5 years.
Excellent. Excellent. Thank you. So how did you get into healthcare? Tell us a bit, why, how you were attracted to healthcare and, and how you started to learn about healthcare and degrees that you pursued.
Thank you. I think one of the things that shaped my career path was the guidance I essentially got from. Oh no! Oh no! Are we going to continue?
Yeah,
I'm so sorry about
that's
that.
fine. That's fine.
Okay, so sorry about that. I just switched it off. I totally forgot to switch it off. um, one of the things that shaped my career path was the guidance I got from the people that I met along my formal education. I would say it was mostly the influence that I got from, I was actually in contact with some of the doctors that treated me because I was diagnosed asthmatic at the age of 2. And so I was in the hospital for quite some time. And the frequency of my hospital visits was quite high. So I was in hospitals and healthcare institutions, in and out, sometimes admitted, sometimes as an outpatient. And that was my interaction with healthcare workers. And then when I was in high school, I then got good career guidance. Our school provided many career guidance opportunities for us. They brought in people from different fields who would hold conferences and interviews with us, and they would offer us advice, and we would be able to know about all these careers. So eventually, I was quite interested in the healthcare system and ended up doing science subjects in high school, and I then proceeded to enroll into medical school.
Wow, that's very impressive. I loved how you recognized the significance of guidance that you received, and actually how because of a childhood illness that's what brought you to healthcare, right? And
Yes.
you kind of grew up in that area, seeing it and being a part of it. Now you mentioned studying science in school. Can you talk a little bit about what kind of sacrifices did you make? How did you force yourself to really do well in school? Because I'm sure you did well in school in order to be where you're at now, but I'm sure it wasn't easy. So what were some
No.
of the things that you did that others can learn from?
Definitely, it's involved investing a lot of time into studying. There was a lot of material to cover in the subjects that I did, because I did science subjects for about 4 years.
Hmm.
So that involved a lot of studying. So I really had to muster up the diligence to make sure that I covered that material that needed to be covered, and also making sure that, whenever I needed assistance, we had a very supportive system as well in high school. So whenever I needed assistance, I got that from my teachers and my mentors as well. So it was definitely not easy. Sometimes it got overwhelming, but I managed with some diligence and with some help as well.
Okay, that's beautiful. And it's great that you had resources available to you and that you took advantage of those resources. So, looking at Zimbabwe today and perhaps other countries that have similar needs, can you talk about the importance of building a stronger healthcare system in Zimbabwe? And, because as young people, you have to decide, well, what career do I want to pursue? And the purpose of this is people, look at this and say, is there a demand for it? And is it something that I would be interested in doing? And how do I develop the skills? Can you talk a little bit about, what is the demand for healthcare in Zimbabwe?
So the demand for healthcare in Zimbabwe is really high. However, whilst the demand is high, I would say the quality of the healthcare system, unfortunately, due to several factors, is falling short and is failing to cater for that demand for healthcare services. So when I got to medical school, and most of the years in medical school are actually clinical, so you are learning in an actual hospital, interacting with actual patients, and that's when I realized that um, it's really surely our healthcare system is falling short, and it's basically up to us as the upcoming generation and as the um, younger doctors to make sure that we change that system and we put in what's needed to make sure that we meet that demand and we improve the health of our people. Because for example, our maternal death rate is very high.
Mhm.
Our neonatal mortality rate is also quite high, and all these things are due to some shortfalls along the way in terms of how healthcare services are being administered, in their availability, their accessibility, the affordability. All those factors need to be looked at.
Thank you. That's very descriptive. And so I guess a question is our listeners think about healthcare opportunities, besides going all the way to be a medical doctor, okay, uh, what are some other opportunities before that that are necessary to help improve the healthcare system? Is it like caseworkers? Is it nurses? Is it dietitians? Can you talk about a little bit about other opportunities that there is a need also that people can do, and maybe sometimes they start off doing something and then eventually they say, hey, you know what, I want to go to medical school, I can do that. They kind of build some confidence as they go.
So definitely administering healthcare services is a multidisciplinary approach. It's not medical doctors alone.
Mhm.
So there are other healthcare professionals who are essential in terms of carrying out um, administration of health services. So from the primary healthcare point of view, mainly those are the nurses. And we have many primary healthcare institutions um, where nurses are actually the ones that are in charge in those institutions. And then most of the time you then get so that's where people go to first, so they present to a clinic or a primary healthcare institution where mainly it's the nurses who are going to be dealing with them. So those are very essential healthcare professionals. So they're nurses, they are also social workers, definitely healthcare social workers, Um, and locally here in Zimbabwe, they're actually a very important part to us, because we find a lot of patients might actually present to us in the hospital, and they are not able to cater for their bills, and yet they are in dire need of healthcare services. So the social workers take care of that. Or we might have homeless patients, or patients who have um, who do not necessarily have a good social support system. So the social workers come in there. We also have the pharmacists who are, they take care of everything to do with medicines that we have to use, and they actually provide us with recommendations as to what to use, because they have that research and they have that information as to the effectiveness of different drugs or medicines. There are also nurse aides, and we also have other professionals like my husband, who's a medical laboratory scientist, and we work with medical laboratory scientists every day, because we send blood samples to them, and then they provide us with results and interpretation of those results, and what they think might be the problem with the patient, and how we can manage them to to be able to cure or treat the disease in question.
Wow, thank you. That's beautiful. And it helps people realize it is a very big ecosystem and there's very many important parts. So, looking at the young professional today, and this could be somebody who's, age 18, maybe a little bit earlier, maybe a little bit older. If they want to start to learn more about healthcare in Zimbabwe and learning about career choices, do you have any recommendations of what they can do to start to learn to help them just understand possibilities in a greater detail?
Okay. So one of the things that I would recommend is getting as much exposure as possible in terms of what the healthcare system is like. For example, locally here in Zimbabwe, what is actually now happening, this is actually just recently started, and it's actually um, being introduced by mainly the private sector schools, who are equipping their students with adequate career guidance. So, what students do when they have finished their high school education, or so that is A level, or they can even come in earlier at O level, where they can actually come to medical school. So they just get a letter from their high school, could be their principal, and then they present it to the medical school, and they can actually come and do what they call a shadowing program.
Hmm.
So they actually come and interact with us, the actual medical students. They come into the hospitals, they come into the wards, and they become, they can even attend the lectures just to see what the lectures are like. Then they also get exposed to the actual clinical work when medical students are interacting with real time with real life patients. So that's one thing that I've seen that is shaping the decisions that these young people then make when they've had such exposure. So I think that that's if some like that is available in the area or in the country where that young adult is, it would be wise to do something like that.
That's really wonderful. Actually, I love that idea. In a lot of industries, you have internships, and so the shadowing might even just precede that or be similar to that. So I think that's great.
Yes.
Okay, one other question related to this is, can you talk about maybe encouraging young adults to find people in the medical field and whether they're a mentor, at least sitting down with them and learning from them, and can you talk a little bit why that's important and how to go about doing that perhaps?
So that's definitely important. It gives them a better appreciation of what the profession entails. And, these are who have been through everything from medical school, and now they are in the professional world as well. So they can give them both sides of the story in terms of, the training part as well as the actual practice. So in terms of how they can do that, um, one of the things would be, whilst people might shy away, but we are actually quite approachable. So I mean, if you know a doctor nearby, just be confident and now approach them and just ask them to know more about their profession. The other thing is that, in their communities, if they can find opportunities to join in volunteer work, for example, medical volunteer work,
Mhm.
that would actually work. Medical professionals are always doing outreach programs as well. These are free and they are open to as many volunteers as possible. So such programs are always they can make use of such programs, and then they avail themselves of volunteer work, and in the process they get to interact with the medical professionals. They create a relationship and they can get the information that they need. um, for someone who's already in medical school as well, there are then opportunities to join in different associations. So there are student associations, they some clubs as well, medical school clubs. And most of those clubs and associations are actually ways of meeting mentors, because the senior doctors, other professionals who are already quite established in the field usually come back and they want to contribute in such associations because they've been through those associations themselves. So I think those are some of the ways that I could recommend in terms of networking with medical professionals.
That is really excellent. I appreciate that. And one question related to that, thinking of these, senior officials who come back, from young people approaching them, what would you say is maybe one positive thing how they approach them? One thing they should do, whether it's calling them by name, listening carefully to what they have to say, whatever. But what's one thing they should avoid doing that sometimes might turn somebody off? So if you could talk about that, maybe one positive way of approaching, that medical professional, and one thing to avoid. And that could be for just, any situation, but in your area, if you have any impressions in that area.
Okay. I think the one basic thing that in terms of the positive aspect, um, you would just want to be as confident and polite as possible. So, that opens up that person, and it makes them, more likely to respond positively to you. So just being confident and being polite when you're approaching them. And maybe, in terms of that, you can just do, if you know the person that you want to be approaching, you can actually do just a brief background check on them before you go and approach them, because now you know a little bit about them. It might be their personal life, it might be their professional life, but you would know exactly how to approach them. So now you have that information and you're just polite and confident in your approach. That would really work. um in terms of the negative, um I would say, um you know just maybe they can avoid being pushy, because so people in the medical professional world, they sometimes have very busy schedules, and it would be wise to be patient with them and make sure that you're not, sort of imposing yourself in their schedule. So, just be patient until they find some time to accommodate you, and you take advantage of that time that they've given you, and you go all in.
That is beautiful. That's really great advice. I appreciate that. Well, we're approaching the end of the interview here, and I guess the question would be: is there anything else that, based on the conversation we've had, anything else that you'd want to give to young professionals to help move them in the right direction, whether it's motivational or informational?
Okay. I would say any career path really is not going to be easy. You're going to face some obstacles, and there's definitely need for hard work, whatever career path you're going to decide to take. So, in terms of motivating them, I would really encourage them to just persevere. I would know from my experience in medical school, because I was in medical school for 7 years. And typically, I was actually supposed to be in medical school for just 5 years, but then COVID came along and we had really long breaks along the way as we were trying to finish up. And this was just in my final year when we had all these delays. And it was quite easy at that point to just think about giving up or losing heart and, just maybe abandoning the program, because it was really depressing at that point when we were all locked down and we weren't going anywhere essentially. And it was just, you were unsure and it was unpredictable what the future was going to look like. So those are some of the obstacles that I faced. One might face very different obstacles, but with diligence and hard work, you definitely get there.
Thank you for that sage advice. And that's really beautiful. Well, on behalf of the BYU Management Society, Mutsa, we thank you for taking time, for sharing really what's remarkable information for people to think about and to practice. And we wish you the very best in the remainder of this year, as life hopefully gets back to normal and the world can improve. So thank you very much for your time.
Thank you very much for the opportunity. And thank you so much for um, the best wishes that you've put across.
Thank you.